So remember, plasma therapy in India is still at the stage of clinical trials. But as we can see, the Health Minister of Delhi has it. Doctors are recommending it for many patients, and patients are going crazy, running around trying to find plasma donors. That's why NDTV has launched Donate Plasma, Save a Life campaign. And joining me tonight are two doctors who themselves had COVID, have recovered, and themselves are asking people to come out and donate plasma. Dr. Jaleel Parker joins me of Leelavati Hospital. Also joining me is Dr. Kalpana Agarwal of Medanta. Thank you both very much for being on the show tonight. Dr. Parker, if we could begin with you. You, sir, have treated corona-positive patients. You yourself had corona and were in the ICU. Tell us about your experience, and do you think plasma donation is important?
Well, there was a day when I started having severe backache, and I wondered as to why the backache is there, especially in the spine, and I was feeling weak. Being a clinical practitioner myself and treating all the COVID patients, I knew that this was, I think, the initial stage of COVID. So I immediately started myself taking ivermectin and doxycycline, which is a recommendation protocol by the Bangladeshis. And I never had fever, no breathlessness, no cough, but the backache was quite severe. So I took those medicines and I completed the 5-day course. But then one night I realized that I was getting even worse. And I thought that I must reach the hospital, otherwise I will die. So the hospital authorities were kind enough, my colleagues were kind enough, the management and all, and they saw to it they sent an ambulance, and I did not even know whether I was in my shorts or in my pajamas or I was naked. That was my state, and I went to the hospital. I was in the intensive care. Now my saturation that time on room air was around 94, though I was not feeling that breathless. But suddenly I realized that I was sinking. And so I discussed with my colleagues, etc., and we started on medication for myself, which was tocilizumab and remdesivir. This was late at night. Early in the morning, I saw that my wife was next to me, and I was quite worried and concerned because I thought I was knocking the door of death, and I was worried that if my wife slips away, what am I going to reply to my son? And that made me determined that I should get out of this. And I struggled my way out, thanks to my colleagues. One of my colleagues who was treating me was Dr. Prabhu Desai.
Absolutely.
And unfortunately, prior to me getting discharged, he got admitted with COVID-19, and he has been discharged today.
Oh, that's great.
Yeah. So getting in those medicines, I think my management and some of my colleagues and some of the anonymous donors, they helped us a lot in getting this remdesivir and tocilizumab also. I took tocilizumab, but my wife was not the candidate because I was worried more about the COVID storm, the cytokine storm.
Right.
And
so you didn't have plasma therapy, doctor, and do you think plasma therapy is important?
Plasma therapy is very important. We've tried plasma on some, and we've been able to revive some, though we would like to treat plasma practically every day on many of our patients in the critical care, COVID ICU. But unfortunately, the paperwork for the approvals, etc., is such a humongous task that we want to save the patient right now, in a minute, in a second, in half an hour, in 1 hour. And that is what is important to us. What irks me and irks my fraternity is that we are here to save patients. And I don't know why these hindrances occur, whether you want to call them red tapeism. I don't know who the authority is, whether it is the ICMR, etc. We are not concerned with that. Right. We are consultant physicians. We are here trained to save the life of a patient. So for us, it is very important that we get that particular
absolutely. And I think the fact that the red tapeism, however we call it, the paperwork, but also from the other side, and I'd like to bring in Dr. Kalpana here, because Dr. Kalpana, You recovered from COVID yourself, and of course our frontline workers, our doctors are the ones who are facing the brunt of it, and you wanted to donate plasma, but the whole experience was a nightmare for you. Tell us about that.
It was more than a nightmare, Sonia, because what happened was that, I was called in by our Residents Welfare Association of the colony where I live in Delhi, and I was asked to donate plasma, and I said yes, I would be more than happy to, because I've been a blood donor now for more than 20 years. And I went to the hospital, a good private hospital in Delhi, very well known. And they asked me, ma'am, you have to get a COVID test done. You should be negative, and then we'll take plasma. I said, fair enough, I'll get the COVID test done, but you can't get the report so soon. They said, no, ma'am, we'll take your plasma and we'll transfuse only once we have a negative report. I said, okay. So they took my COVID sample, my nasopharyngeal swab and all. Then they took a blood test, which is normal for any donor. And after I waited for almost 2.5 hours, and I started kicking up a fuss that, look, why aren't you telling me what is happening? Why aren't you taking me for my donation? And the lady who was the chief medical officer or the medical superintendent, she says, speak to the blood bank in charge. Then I spoke to the blood bank in charge, and she says, madam, how many children do you have? I said, excuse me, how does that have a bearing?
Right.
So I said, in any case, I have 2 children. Ma'am, if you have 2 children, we can't take blood from you.
So this came after 4 hours of you already being there?
After 3 hours of my being in the hospital. And this was it was actually my first outing after being in isolation and then quarantine and all the rest of it.
Right.
Anyhow, this lady said that, no, we cannot take plasma. I said, give me a reason why you can't take plasma, and I'll be more than happy to, kind of abide by it. No, madam, if you give plasma, then it will harm the patient, so you cannot give plasma. My only angst in this whole episode is that they should have set guidelines. They should tell the patients that so-and-so is a likely candidate for you to donate plasma. The hospital should have guidelines, the blood banks should have guidelines, the government should set out guidelines that these are the patients, these are the individuals who are qualified to donate plasma, and this list of individuals is not qualified to donate
and I
plasma.
think that's absolutely, in fact, I think what both you and Dr. Parker are saying is so crucial at this point, that there's so much confusion. Patients are being told by doctors to arrange plasma yourself. They don't know how, they don't know where.
Absolutely.
They don't know the guidelines, and this is what I hope our centre and our chief ministers are really looking at. You need those guidelines fast, because as Dr. Parker...
I was met by a Delhi government official at the hospital. And so obviously the government was very much involved in the whole thing, and he was very grateful, and he says, I'm so glad you've come in, ma'am, and then let's get this done. And at the end of 3.5 hours, I walk out again without having donated plasma and being told that, no, you're a multiparous female, you cannot donate plasma.
And the patient's family must have been distraught also. So I think that really, how do we shift our focus to getting patients life-saving care? And as we put it, we're very glad the Delhi Health Minister has recovered. We wish him good health, but he got plasma therapy. He didn't have to go through what everybody else is going through to get it right now. That's what we need to fix. And Dr. Parker, Dr. Kalpana, thank you so much for having your voices on the show tonight. We hope that this will actually build up awareness on what's needed to change. Thanks very much for that.